Hey guys, so I have a cracked crown on my good side and I'm experiencing some discomfort from it, which is making eating even worse than it already was. I made a dentist appointment for today at 10 a.m., but last night I ended up having a panic attack. As most of you know, going to the dentist is really traumatizing, especially for those of us who had our TNs start at the dentist like I did. I was just sobbing and ready to give up, and I just didn't want to go through this. It's so hard. I don't want to be in more pain than I already am. I know that going to the dentist is going to make the pain even worse too. So I decided to reschedule the appointment for Thursday. Today is Tuesday, and I'll go ahead and rest for the next 2 days until the appointment, and we'll see how it goes. Okay, so I gathered some questions so I could ask the dentist before my appointment on Thursday. I called and asked, what is the procedure? So they told me it's just an evaluation and an x-ray. I asked how long the procedure is. They said a half hour, but it could go quicker than that. She said it'll be mostly conversational, so not a lot of work in my mouth, so that made me feel a lot better. And I asked when I do get the temporary crown and all of that, if sedation is possible. And she said that we would have to schedule it for a different day, but there are 2 different options for sedation. So we'll talk more about that on Thursday. So I'll provide another update then. Talking to the dentist's office really made me feel better. It eased my mind to know that I'm not going to be necessarily in more pain on Thursday. They're just going to go in and take a look. No dental work will be done. So it really is just making my anxiety better. And there's a plan and a process. And, you know, even when I get the crown or whatever needs to be done, I know that there's options for me to make it easier to get through. Today is Thursday and I'm on my way to my dentist appointment. Michael is taking me, thankfully. I'm feeling really nervous. I didn't really sleep that well. I'm in my normal amount of pain, but it's, you know, flared because I'm nervous and scared about going to the dentist. Yeah, I'm gonna use some lavender essential oil to try to calm me, and I am telling myself that I'm safe and I'm protected. And Michael keeps reminding me that it's an easy appointment today. It's just a checkup and an x-ray, so nothing to be too worried about. So I'll check in after. Okay, well, the dentist did not go very well. He took an x-ray of the bottom right, which is my good side and where I'm having discomfort. There is no abscess or cavity there. He also asked about my pain on my left side, which is my TN side. And he did an x-ray of the top left, and there was no abscess, no cavity. And then he wanted to do an ice test on the top left, which is my TN side. I already said that. But I stupidly allowed him to, and it caused a shock. I started crying. It was awful. He kept asking me if I was okay. He just kind of kept blaming everything on TN, saying that my symptoms were overlapping, and he suggested that I get my molars on the top left and the bottom right extracted to help with the TN. He made this suggestion because another patient of his has trigeminal neuralgia, and that works for him. The one thing we all know about TN is that no two diagnoses are the same. So although that may have worked for another person, that may not work for me. So I'm not going to be extracting any teeth right now. I'm only 32 years old, and that's an irreversible procedure. So I'm kind of just frustrated right now. I want to get another opinion. He did give me a prescription for antibiotics, so I'll probably take those for a couple, 3 days and see if it takes some of that discomfort out. It doesn't feel like trigeminal neuralgia. It's not shocky, it's just kind of a dull pain. It gets worse when I bite down. So I'm just gonna have to figure this out by myself.